Assistant Professor from SNS College of Physiotherapy. Today my mentees are going to discuss about a peculiar condition called Usher syndrome in stroke. Usher syndrome is usually diagnosed after a subacute period of the stroke. In such cases, there are a variety of clinical features and management strategies also difficult to manage the Usher syndrome. So let's see how our mentees are going to present this as a group discussion. Yes, you can start.
Good morning. Our group is going to present the seminar in Usher syndrome of stroke. It is a condition significantly affects balance and rehabilitation. So that the outcome is very close. So stroke is a leading cause of disability worldwide. It has so many complications. And Usher syndrome is relatively very low in clinical importance. So we are here to present a definition and causes, clinical features, assessment methods, and management strategies.
So what is the definition of pathophysiology?
Usher syndrome is also known as conservative pushing. This condition is present in some stroke patients where they actively push their body towards the paralyzed limb using their non-paralyzed limb. This occurs due to disturbance in the perception of body or coordination in relation to gravity. Patients feel that their body is upright even when it tilts. This condition commonly associated with the lesion in the thalamus posterior parietal cortex. Interestingly, the visual system remains intact, meaning the patient can visually perceive vertical alignment parallelly, but their internal sense of upright posture is intact.
Yes, as he said, Usher syndrome is nothing but the patient feels upright even if the patient bends sideways. The patient do not feel that he is tilting his body. He will be unaware of pushing, so that it is more important to prone for fall. So the patient do not able to cope up with the pushing syndrome will have more falls comparatively to the other stroke cases. So this can be unnoticed by the attenders, but it can be easily identified by therapists like us. So let's see what are the clinical features.
The clinical features for Usher syndrome are active pushing towards the inferior side, use of non-affected limb to push away from the non-paralyzed side, resistance of massive correction to posture, increase the risk of fall, especially towards the affected side. This behavior is not due to only loss of muscle, but also altered perception. These patients are often show poor sitting and standing balance and difficulty in functional mobility. Because of these symptoms, rehabilitation becomes more challenging.
Yes. So in stroke cases, balance is very important to attain the weight training. In that Usher syndrome cases, we cannot achieve the static balance. Even in the sitting, you need a supported sitting. You cannot make the patient to sit unsupported. If you make him to sit unsupported, the patient will prone to fall on the affected side. That is the Usher syndrome. So it is challenging for us to bring the good balance in the static sitting posture. Then only we can go for the dynamic balance training. So what can be the assessment strategies for us?
So the assessment of Usher syndrome is mostly clinical. The mostly used tool is called as scale for controversial pushing. So it consists of three components. So spontaneous posture, uses of limbs, and resistance to correction. Spontaneous posture refers to whether the patient tilts to one side, and the use of limbs means that whether the patient is using non-paralytic limbs, and resistance to correction means that whether the patient is giving resistance to the while being corrected to upright position. Plus, imaging techniques like MRI and CT will help us to identify the exact location of the brain fever.
Yes, MRI and CT will help us to identify the localization of the lesion in the brain, and we can use the controversial pushing scale to quantify how much the Usher syndrome is affected to the patient. Some patients will be having pushing when they are sitting only without support, they will be having support to the upper limb. Some other patients will make the sitting as a difficult task, like if you make the patient to sit in a chair or in the bed without support, the patient immediately fall on the affected side without any external force. That kind of severity can also be noticed. So how can we manage the disease?
The management of Usher syndrome mainly involves rehabilitation techniques, particularly physiotherapy. The key features include visual feedback. Visual feedback such as mirror help the patient to identify the position, training patient to shift weights towards their unaffected sides, practicing sitting, standing, and balancing exercise, encouraging active participation of the patient rather than forceful direction. The therapist focuses on retaining patient's perception and vertical alignment. Although recovery may take time, the patient may show improvement with consistent therapy. Thus, I conclude my speech that Usher syndrome is a unique and challenging condition in stroke rehabilitation. Early identification and proper management are essential to improve the functional outcomes of the patient.
Yes, good. So as we said, we can use some mirror therapy to make the patient understand that he is falling without conscious. And we can use the weight bearing strategy that you have to bear the weight only on the unaffected side, not on the affected side. That will help the patient to aware of giving weight on the unaffected side. And you can also train the imaginary techniques like make them to visualize that they are sitting straight without any shift in the body weight to the affected side. These kind of techniques can be helpful in Usher syndrome. Along with the static balance training and trap balance training will help the Usher syndrome patients to recover more. But it is crucial to identify the Usher syndrome. It can be diagnosed as a falls in stroke mistakenly, but you have to clearly identify whether it is a Usher syndrome and what are the clinical features, what are the criteria that are met for the Usher syndrome. Then you can set the management goals accordingly. So also with the other conventional physiotherapy for the stroke management, you should include the treatment for the Usher syndrome also in the regular protocol of the physiotherapy management of the stroke. So hope you all get an idea about the Usher syndrome in this group discussion. So we'll discuss something later in detail about this condition. So thank you all for watching this video. We will catch you in some other. Thank you.